All right. Well, here we are, 11 a.m. So, well, depending on what time, where you are in the world, it might be a different time, but where I'm sitting, it's 11 a.m. So it's time to make a start. So I'm just going to, just because, we've got loved ones, pets and dogs and radios and things in the background, I'm just going to mute everybody, but I'd love you to just feel free to unmute anytime you want to say something. I'd love to have your input. So today's topic is obliques, the anatomy and biomechanics of the obliques. And the reason I wanted to talk about this is because I get a lot of questions about it, both inside and outside the training that we do. And it's one of those things that I think even if you've studied it a bit, it's, a bit of a refresher often makes it stick in there a bit better. And for many of us, for me, this was the case, it takes several attempts at getting it before it makes sense. So that's why I wanted to talk about obliques, but I'd really like to start out by just throwing it open to all of you on the call and just asking you, okay, you can just unmute and verbalize, or you can type it into chat, whichever you prefer. What do you already know about obliques, and what are you not sure about? What's not clear to you about obliques? Because that'll give us a good starting point. So I'm not teaching you how to suck eggs. So what do you already know? Just throw me out some factoids. What does make sense to you about the obliques, and what's not so clear for you? And you can unmute and just say whatever, or you can type it in. And any
I'll go first.
Okay, great, Chintzia.
I know that there are certain exercises that we do in the Pilates repertoire that fire up the obliques, and you can usually feel them. And then there are some exercises that give you a whole body sort of conditioning, and it will fire up the obliques very minimally. Okay, great.
Who else has got something that you either know, or you think you know but you're not sure, or you're just totally confused about, or you have a question about? Sarah says they wrap around the ribs from the front of the body to the back and vice versa. Andrew says there's internal and external. Both of those are correct. What else? Give me something to work with here, people. Julie, I can see you talking, but I can't hear you talking. Still no. And my lip reading's not up to scratch, I'm afraid.
The right oblique turns you left. The right external oblique turns you left. The left internal oblique turns you left.
Zoe.
And then the left external turns you right. The right internal turns you right.
That's pretty good. Hey, Indy. Nice to see you. You're on planet Neptune, I see. Hi, Sarah. Hi, Rachel. Hi, Jade. You look just like you do on Instagram. No, it's funny because I follow you on Instagram, and usually I see you doing Pilates, right? So I normally see a side view of you doing like long stretch or whatever. So seeing you from the front, you actually kind of look different. All right. So why are you not adding anything here? Is your mind completely empty? Do you have, if I say obliques, is there just white space in there, or are you worried that you're going to say something and it'll be the wrong thing?
I have a question. I was going to type it, but I'll just ask it.
Go ahead.
Does stretching your obliques help with back pain? I'm asking this because a chiropractor told me to do this.
What a great question. Does stretching them help with back pain? Sarah asks, which exercise can we give someone with sciatica? All right, so the sciatica question, Sarah, is a freaking great question, but it's way outside the scope of today's conversation. So I would love to answer that, and that'll definitely get put on the list. And Chloe's going away for a couple of weeks. Well, in Melbourne, we don't go away, but she's having a staycation for the next couple of weeks. So I'm going to take the opportunity to record a whole bunch of answers to questions as an elephants episode. So I will definitely get to that one in the next couple of weeks. All right, so obliques. All right, so let's start from the start. If I say anything that doesn't make sense to you, or if you've got something you'd like to add, like something you feel needs to be said that I miss out, like just unmute and yell it out or type it into chat. So the obliques are abdominals, and we have 4 layers of abdominals. The rectus abdominis is your six-pack, and the transverse abdominis is your deepest layer of abdominals. The rectus abdominis isn't really deeper or superficial. It's kind of not. It's neither deep nor superficial. It's both. It's not layered with the other ones, and we talked about that a couple of weeks back. And then you've got your internal and external obliques, and the internal and external obliques wrap around basically from behind the rib cage to the front of your abdomen. And the word oblique in Latin means at an angle. So anytime there's something oblique, that just means it's diagonal, basically. And so the obliques are called oblique because their fibres run diagonally. You know, they're not straight up and down, they're not straight sideways, they're more diagonal. And they're kind of, the external oblique is actually quite simple in its anatomy, and the internal oblique's a little bit more complex. So we're going to start with the external oblique to warm up and see, so that can kind of all make sense for you. And then we'll go to the internal oblique, and along the way we'll talk about which exercises are going to target those and what their actions are. So let's see how the technology is going. I've got a textbook here which has got a beautiful picture of the obliques, and so this is a front view of the torso. There's the belly button, okay, there's the pubic bone down here, and that kind of yellow thing there is the sternum, and that's the xiphoid process there. So this here you can see is the pectoral muscle. So it says pectoralis major, that's the pectoral muscle. And then you've got the serratus anterior, and the external oblique really interdigitates, like your digits are your fingers, okay? That's where we get the word digital from. And when it interdigitates, it just means your it's like if you interweave your fingers of each hand together, okay? That's what interdigitating means. And so the fibres of external oblique interdigitate with the fibres of the serratus anterior there. They kind of interweave, and they kind of weave together like a basket almost. And you can see that the fibres of the external oblique run down and forwards, and the lower fibres and the upper fibres pretty much all run in the same direction. They all run down and forwards at about a 45-degree angle. Okay. And they insert. The insertion is just the attachment point that is furthest away from the spine, basically. So they insert into this big white thing here, which is called the abdominal aponeurosis. That's it there, aponeurosis. And an aponeurosis is just it's a tendon that connects to the other end of the same muscle, right? So this is your right external oblique, okay, that pulls on this tendon here. And then there's this tendon here, and guess what's on the other side of that tendon? Well, your left external oblique's on the other side of it. So when your right external oblique pulls, it's pulling on the left external oblique. That's what it's pulling on, okay? And so an aponeurosis is a tendon that connects one end of the muscle to the other end of the same muscle. okay, when the muscle is a loop around some part of the body. And we've got that in the diaphragm as well. The diaphragm has what's called a central tendon or an aponeurosis, okay, where it connects it to itself. So anyway, that's your abdominal aponeurosis, and your rectus abdominis sits within that muscle, within that sheath, okay? And that's the external oblique. Well, this is the front view of the external oblique. So let's take a look at a much less skillful drawing of that. I can pretty much guarantee it's much less skillful, but we'll do our best. All right, so the fibres of external oblique run kind of like that. Those are the muscle fibres. Runs up to the fifth, actually, goes up further. It runs up to the fifth rib. 1, 2, 3, 4, 5. So it goes up to the fifth rib. It's quite far. And then you have the aponeurosis, which what colour I'll do that blue, even though in real life it's not blue, obviously. But just because if I use white or light brown or anything, it's not going to be very visible for you. So the aponeurosis, which is just the tendon, okay, runs like so. Is that kind of visible enough for you to get the gist of? All right. Now, if we think about that from the side view, because we couldn't quite see the side view on the textbook, the side view, the external oblique originates behind the midline of the rib cage. So if we draw an imaginary, line going down the middle of the body from front to back, okay, the external oblique starts behind that imaginary midline. Let's get rid of, whoops. There we go. Let's put this on here. All right, so the external oblique runs from behind there and it runs down and forwards, okay, to the aponeurosis and to the front half of the pelvis, and then down to the symphysis pubis there. And then you have the aponeurosis, which is that part of it there. Probably if I drew that even better, it would just be straight lines like that. All right, so if we think about, what movement that muscle would cause, okay, well, all it's going to do is it's going to pull that way, and it's going to pull this that way. Maybe we can do an even better colour. So it's just going to pull this like that end, closer to that end. And so this is just from the side view, okay? So can you picture, if we just, again, think about it just from the side view, not worrying about rotation or any kind of, side bending or that kind of thing, okay? Can you picture what movement that might cause if we just pull those two body parts, this kind of posterior part of the rib cage here and the pubic symphysis, okay? Pull them closer together.
Tightening.
Yeah, well, you pull this up and back, okay, and this down and forward. Keely asked, so does caesarean cut through the aponeurosis? Yes, it does. All right, so let's see if I can get the skeleton. Need my special skeleton stand. What's gaffer tape not good for? All right, so if the external oblique runs roughly like that, okay, well, it's going to pull this and this closer together. Okay, so that's going to end up looking like a combination of flexion, okay, which pulls this down and forwards, but also just anteriorly displacing the rib cage and pulling the pelvis back into a posterior tilt. Okay, so it's going to posteriorly tilt the pelvis and pull it back in space, as well as flex the rib cage and pull it forwards in space. Right, and so if we look at the distance between those 2 points there, you can see, right, as we go to standing in a more neutral position, they move further apart. Okay, and as we posteriorly tilt and pull it back in space, they move closer together. Does that make sense to you? So in IRL, okay, in real life, what that looks like is this. That's external oblique relaxed. This is external oblique contracted. Why don't you try it with me? You've seen Joseph Pilates' like famous posture shots, right? In Return to Life Through Contrology, and his correct posture shots where you stand with your guts in and your chest up and like that. Well, that's the action of external oblique. So let's do it together. Nice one. So the reason I pulled my T-shirt in there is just to show you that there's kind of a sucking in of your guts type component to that, because external oblique does compress the abdomen a bit. Okay. So does that kind of make sense in your mind's eye, that if you're pulling up and back on the symphysis pubis, okay, and at the same time you're pulling kind of forwards and downwards on the ribs, on the back of the ribs, okay, that's going to cause that movement that we just did? Or do you have any questions about that? You cool with that? Okay, so the next component is, well, what if we recruited just one side of that muscle, because you've got a left and a right, obviously, of your external obliques. Okay, and so what would it look like if we just recruited only one side of that? And so, thinking about that, well, we'd still get this exact same action over here, wouldn't we? I mean, that would still be the same, okay? But it just wouldn't happen on the other side, okay? And there'd be something different that would happen when we just did one side, because see these fibres here, they run diagonally, right? So they're going to pull down that way and up that way, right, on an angle, right? So they're going to pull this part closer to this part, would be a more accurate way of thinking about it. Okay, they're going to pull this part this way and this part this way. And you see that that's not just straight down and up. There's an oblique axis. It's diagonal there, okay? So they're going to pull your symphysis pubis basically up and back. They're going to pull your ribs down and forwards, okay? And what that looks like, here's the rib, okay? That's going to come down and forwards, okay? Symphysis pubis is going to come up and back. And so you're going to get opposite rotation of the pelvis and the torso. Can you picture that? The diagonal fibres going this way, pulling the ribs down and the pelvis up. Try it on your own body. Okay. Come up to standing. Hand on your ribs and the external fibres of the oblique, the external oblique, the fibres go down and forward, so that it's like kind of a hand in pockets movement. Okay. So pull your ribs down and forwards. Okay. Now keep them there and pull your symphysis pubis up and backwards. So it's just enhancing the rotation, right? So your hips turn one way and your ribs turn the other way. And that's the action of external oblique in the looking from the front. Does that kind of make sense to you, or do you have any questions about that component of it? All right. So there's a pulling backwards of the pelvis, backwards and upwards of the pelvis, and forwards of the rib cage, forwards and downwards of the rib cage. And if we do that together, then we just get this kind of standing up straight with your chest out and guts sucked in sort of thing with the pelvis pulled back. Okay. And if we do it just one side, well, we get a rotation plus we get a side bend. Okay, because I'm not sure how well I can show you the fibres from the side, but if we look here, I guess if we look here and think about, this here is going to cause some kind of, it's going to pull the ribs down on this side, okay, and it's going to pull that up on that side, so that's going to cause some kind of side bend of the torso if we're not contracting the other side at the same time. Does that make sense to you? All right, so we're going to get, if we contract just one side of the external obliques, a movement that is a combination of pelvis up and back, ribs down and forward, plus side bending to the same side. Okay. So it'll look like this. Side bend plus twist plus flexion plus posterior tilt. Try it on your own body. Okay. So the ribs come down and forwards, pelvis comes up and backwards, and then you side bend to the side of the ribs that came down and forwards. Okay, so if it's the right ribs that came down and forwards, you side bend to the right. And can you picture those fibres in there just really short as you're in this position? And as you come out of it, can you picture those fibres lengthening apart? Can you picture that in your mind's eye? Do you have any questions about that? Sarah has a question. She says, Raph, I've been working on my diastasis recti for over a year now and it still flares up sometimes, and that movement actually hurts me. How long would you recommend giving oblique work and TA exercises only to people with diastasis recti? Good question, Sarah. And we don't have any research to guide us on this. Well, no, that's not true. We have some research to guide us on this, but it's not very good quality, and it's what we see so far in the sparse and low quality literature on abdominal exercises for diastasis is that any kind of abdominal strengthening is of benefit. So I wouldn't particularly, as a sort of matter of course, I wouldn't say, hey, you should only use these muscles or only use those muscles. I would say, though, that if just in general in any kind of rehabilitation situation, that you should gradually build tolerance to load. And so if that movement hurts, I wouldn't necessarily say that's an indication that you shouldn't do it. I would generally go with the rule of thumb that if it hurts a bit during, that's probably fine, but if it continues to hurt for several hours afterwards, that's probably you overdid it. And so if it's a bit uncomfortable during, but then it as soon as you stop doing the movement, it feels fine. I would say, yep, if you're fine with that, I'm fine with it. And just gradually, be consistent, build up your tolerance. But if you build it up to the point, if you increase the load or how much work you do at some point, and then the pain continues for like 24 hours after you've finished the workout, I'd say that's probably an indicator that you sort of overcooked it. You did too much on that particular day. So it's not super scientific. It's kind of just a rule of thumb, but that would be the way I would approach it. More from just a general load management rather than, isolating particular muscles. Because the obliques and the TA are actually going to pull apart on the aponeurosis, whereas the rectus actually pulls it together. So you really do want to work them all together probably. I hope that made sense. All right, so how are you guys traveling? Is this how are you feeling with the external obliques? Do we need to spend more time on that, or are you cool with that? Do you have any more questions about the external oblique? All right, so let me ask you a question. Please type it into the chat. The right external oblique rotates you in which direction? The right external oblique rotates you in which direction? Rotates your ribs in which direction? Which way does the right external oblique rotate your rib cage? And the correct answer is to the left. Jolly good show, everyone. All right. Next question. And type this in as a private DM to me, please, because that way no one can copy your correct answers or your incorrect answers. External obliques cause posterior pelvic tilt, true or false? External obliques cause posterior pelvic tilt. And by posterior pelvic tilt, I mean the pelvis tilting that way. External obliques cause posterior pelvic tilt, true or false? And the answer is true, because they pull up on the symphysis pubis. External obliques cause flexion of the rib cage, true or false? External obliques cause flexion of the rib cage, true or false? And the answer is true. Unilateral, that just means one side only, okay? Unilateral contraction of the external oblique, so in other words, just contraction of one external oblique, causes side bending to which side? Same side or opposite side? Same side or opposite side? All right, the correct answer is same side. Not all of you got that though, so let's just think through it for a second. Well, did anyone say same side? Well, I know quite a few of you said same side, and doesn't mind having a crack at explaining why it's the same side? Best way to learn is to teach.
Raphael have punted this.
Okay.
Is it because that's just the gradual way that your body's pulling, like one direction, another direction? It's just natural to go into that. That's, I don't know. To me, it just sounds logical that that would happen.
Your answer is correct, but on your working out's a bit messy.
Okay.
Why does the external oblique side bend you to the same side? What are the two bones that it's pulling together? Muscles pull two bones together, right? So what's this external oblique pulling together? The what and the what?
Rib cage to pubic bone.
Right. Rib cage to pelvis, right? Like, if we zoom right out, okay. Which side of the rib cage to which side of the pelvis? So the right external oblique pulls the right or left rib cage. Right, okay. The right external oblique pulls on the right or left side of the pelvis. Right. So if I pull the right side of the rib cage and the right side of the pelvis together, which side do I bend to? The right. Does that make sense? Anyone still a bit fuzzy on that? If you are, it's cool. We can keep talking through it. When you side bend, right, can you picture those fibers going from your ribs down to your pelvis, and can you picture them shortening and bringing the pelvis up and the ribs down? Okay. And that's why it bends you to the same side. Okay. But it rotates you to the opposite side, right? Because the right external oblique brings your right ribs forward. Okay. And of course, do this with me. Bring your right ribs forwards. Which way did you just twist? You just twisted left, didn't you? Okay. When your right ribs come forwards, you go left. Okay. So the right external oblique twists you left, but side bends you right. Make sense? All right. Do you need a quick brain break? Maybe 5 push-ups, something like that? Sarah says, so side bend versus oblique twist. So basically, if you do a side bend, okay, well, the side that you're bending to is going to be working, right? So if I'm bending to the right, say I'm doing like a Pilates side bend, where like a side plank sort of thing, okay, where I'm shortening on the right side. Well, that's the side that's working. I mean, you know this from your own experience, right? When you're doing a plank, it's the bottom side, okay, the side closest to the ground. That's the side that's working, okay? But when you're doing a crunch, right, it's the side that's coming forward that's working, not the side that's down on the ground. Okay? And that's because the external obliques twist you the other way.
Raph, when you said unilateral, I'm just going to double check. Is that the technical way to say side bend?
No, uni means one, like a unicycle only has one wheel. Okay. And lateral means side. So unilateral literally just means one side. So we
The twist, and then I realized that wasn't what you were talking about.
Right. Yeah. Really great question. So we can talk about unilateral just means one side, because you've got a right and a left external oblique. Okay. So if we're just talking about the right one, we're talking about unilateral, just one side. Or we could talk about bilateral. Bi means two, like a bicycle has 2 wheels. Okay. So bilateral would be both sides, 2 sides, and that would, if we contract them together, then we get no rotation because one side wants you to rotate this way, the other side wants you to rotate the other way, okay, and they cancel each other out. We also get no side bending because this side wants to bend me this way and this side wants to bend me this way, so they cancel each other out, okay? But we do get flexion because this side wants to pull this down and this side wants to pull this down, so everything goes down. Does that make sense? Good question. All right, so let's think about this. You just say we're doing an oblique crunch, right? You're lying on your back. If I lie on my back, you won't be able to see me, so I'm just going to pretend I'm lying on my back whilst I'm sitting up, right? But just imagine I'm lying on my back, okay? And this is my right side, okay? And you do it with me. So twist your right side and crunch, okay? So twist your right chest forwards and crunch, okay? Which oblique is that using? Right or left external oblique? Think it through, see if you can figure it out. And the correct answer is the right external oblique, okay? If you're bringing the right side of your chest forwards, that's the right external oblique pulling your right ribs forwards. Does this make sense? Okay. All right. Let's try another one. Say we're doing a side bend. Okay. This is my right side. Okay. Imagine I'm not on the floor, but imagine I'm on the floor. This hand's on the floor. Okay. My right foot's on the floor. My right hand's on the floor. My right side is facing down towards the floor. My left side's facing towards the ceiling. Okay. I'm just in a side plank at the moment. Okay. Which external oblique is working, right or left? Bottom side or top side? Type it in. And the correct answer is the right, the bottom side. Okay. All right, so now we're doing side bends, but now we're on the reformer long box, or maybe we're on the ladder barrel. Okay, so basically our hip is resting on the long box, short box. Okay, our hip's resting on the box, foot is hooked under the strap. Okay, and now we're side bending to the right. Okay, it's our right hip on the box. We're side bending to the right. Okay, which external oblique's working, right or left? And the correct answer is left. All right, so a couple of you are thinking, what the heck? Okay, so let's see if we can figure out the answer to that. So here's your reformer box. Not a terribly good rendition, but hopefully you get the gist. Okay. So, in fact, I did that back to front. But anyway, let's just talk about top side, bottom side. So, which way is gravity going? Which way is gravity put? If I relaxed all my muscles there, which way would I bend? Okay. I would go that way. Gravity's taking the body that way. Okay. So if I want to bend that way, do I have to use muscles to do it? No, if I say to you like fall on the floor, which muscles do you have to use for that? None. You just relax. Gravity does it for you, okay? But if I want to go this way, gravity doesn't want me to go that way, right? So I have to use muscles to go that way, okay? Now, what's shortening? Which side of me is shortening as I go this way? Right, the top side. Can you see it's the top side? So if we pull this here and this here, that's going to lift me up. So it's the top side that has got to shorten under load to lift me up. Does that make sense? Any questions about that? I'm especially looking at you guys who said left when I asked the question a minute ago. You cool? All right, and so if we then just think about that, like as now just on the floor, okay? So same body orientation. There I am on the floor. Okay. Well, now, which side's working? And it's the bottom side, okay? We already went through this a minute ago. Okay, so now gravity wants to take me this way, okay? But if I was to relax all of my abdominals, I would actually sag down, wouldn't I? Right? So I would bend that way if I relaxed, okay? So in order to not sag down, okay, I've got to contract that and that closer together to stop me sagging down. Does that make sense to you? Okay. So even though they're both side bends, they're both facing the same direction, okay, when you're supporting on your hand and your foot, it's the lower side that's working, whereas when you're on a box, It's the upper side that's working. And when you think about it, you're thinking like, yeah, duh. I mean, I know that, do that every class, right? But what's important for today is that you're not just memorizing what it feels like, you're actually picturing what's happening inside the body, right? You're picturing in this upper position here, the hips and the ribs being pulled closer together. If I could draw it, okay? And here you're picturing the bottom rib and hip being pulled closer together. Can you picture it? All right. So how are you doing with external obliques? Any questions, or are we done? Sarah, you sent me a message. I can't quite read it. I felt it in my something.
I was just saying right side, but I just really felt it in my right side. But I understand what you're saying, that the left side is going to pull you up and gravity's pulling you down to the right.
Right. And if you got on a reformer and stuck your foot under the strap and got on a box and side bent a bunch of times, it would be the top side abs that would get tired, that would stop you from continuing. All right. So you're ready to move on to the internal obliques? All right. You guys are doing good. So let's see if we can get all these clear and show you back these ones. All right. Let's get rid of that, and then let's create another layer here and call this internal obliques. I fear I've drawn on my skeleton there. That's all right. I can do it on the other side. That's good. All right. So internal obliques are interesting because their fibers don't just run in one direction. So we said the external obliques, their fibers are basically parallel, the top and bottom fibers, whereas the internal obliques, the fibers kind of curve. The upper fibers run up. Okay, the middle fibers are more parallel, and the lower fibers kind of run down like that. And then, of course, you've got the other side of your aponeurosis there. And if you're, those of you who are like super switched on already and thinking 3 steps ahead, will be thinking like, well, hold on this side, you've on the first set with the external obliques, you've drawn the aponeurosis kind of facing diagonally down, okay, same as the fibers of the external oblique. And on the internal oblique side, you've drawn the fibers, kind of the upper fibers facing up and the middle fibers facing middle and the bottom fibers facing a bit downwards, just like the internal oblique. So which is it? And the answer is, well, the aponeurosis has different layers. Okay, there's an external layer and an internal layer, and they have different fiber orientations. So they're both correct. And if you were thinking that, by the way, that's smart. And if you weren't thinking it, and you can still figure out when your right external oblique's working when you turn left, that's still pretty awesome. All right, so the internal oblique, the upper fibers run upwards a bit. The middle fibers are more horizontal and the lower fibers are very slightly kind of facing downwards. Okay. And if we look at that from the side view, okay, it runs kind of like this. Okay. So we've got some fibers here that are pulling the rib cage down and the pelvis up. And then we've got some fibers in the middle that are really not flexing or extending anything. Then we've got some fibers down the bottom that are kind of pulling the symphysis pubis up a little bit. So, and at the back here, these back fibers insert into what's called the thoracolumbar fascia, which sits around here. So if we drew the thoracolumbar fascia it'd be about like that. Wouldn't be blue, of course, it'd be white in real life. And the internal oblique would be like that, and then like that. And it connects into the bottom couple of ribs, and then like so. So that would be the back view. All right, so thinking about that fibre orientation in terms of the upper fibres, okay. So thinking in terms of these upper fibres here, okay, and disregarding for a moment the other fibres, because there's really 3 sets of fibres, so it's going to have 3 sets of actions, right? The fibres point a different way, they're going to have a different action. Okay, so thinking about those upper fibres, well, look at these fibres of external oblique. Okay. Then look at these fibres of internal oblique in terms of the fibre orientation. Okay. Can you see that they're basically, they run the same way? Can you see that? They're basically parallel. And so what that tells you, right, is that they're going to have the same action if the fibres run parallel, right? Think about it this way. If I said there's a straight road, right, you're on a straight road, and at the other end of this road is Sydney or some other city, right? Okay, let's call it Sydney, right? And there's a road 1 block over that runs exactly parallel to this road, right? If you get on that road 1 block over, does that go to Sydney? Well, yes, it does, right? If it's the same length as this road and it runs parallel, it goes to the same place. Okay, so what I'm saying to you is, well, if we've got 2 sets of muscle fibres that run parallel to each other, right, they run in the same direction, well, they're going to pull in the same direction. Does that make sense to you? So, again, just these upper fibres of the external oblique here, okay, they're going to pull this down this away. Okay, we already talked about that. Okay, and then you've got these fibres of the internal oblique. Okay, well, they're going to pull this down this way too. Can you see how they both pull in the same direction? Because they run parallel, right? So if I've got in an external oblique that runs this way, okay, pulls the right side of the ribs down to the middle of the pelvis, so it pulls me down this way, okay, and then I've got an internal oblique on the opposite side that runs down and back, well, it's going to pull the opposite side down and backwards. Right, and if I pull my left side down and back and my right side down and forwards at the same time, well, guess what? They're both going in the same direction. Try it on your own body, okay? Put your right hand on your right ribs, your left hand on your left ribs, okay? Pull your right ribs forward and your left ribs backward. Well, that's the same thing, isn't it? Right ribs forward, left ribs backward. It's the same movement, okay? And that's rotating you to the left. Okay, so when you pull your right ribs forward, that rotates you to the left. When you pull your left ribs backward, that rotates you to the left. When you pull your left ribs backward, your torso is turning left. Is this making sense? So the internal oblique, okay, the left internal oblique rotates you to which direction? The left internal oblique rotates you in which direction? Those of you who are doing it on your own body, that's the correct way to figure this out, right? I can see you making pictures in your mind's eye of what's happening in there. The left internal oblique rotates you which way? The correct answer is left. Why is the correct answer left? Anyone want to have a crack at explaining it? Julie, I'd love to hear what you got to say. Unplug your headphones and just talk into your computer.
Didn't think about that, did I? Well, because that's the way the muscle fibers pull. So the muscle fibers are pulling up and back. So it's that same.
Right. So the left internal oblique is pulling your left ribs back.
Yeah.
Right. And when you pull your left ribs back, well, that's turning you to the left. If you've got a perplexed look on your face right now, put your hand on your left ribs, pull your left ribs back. Which way did you turn? Good explanation. Anyone still? I can see a couple of you got questions about that. So what are your questions? What's fuzzy for you about that?
I just thought you said forward, not backwards.
Okay. So, all right, good. So the internal obliques, okay, these upper fibers, we can see they run from the front of the rib cage here, okay, to the back of the pelvis there. Okay, they run from the front of the rib cage to the back of the pelvis. So if you think about those upper fibers of external oblique, they run from the front of the rib cage to the back of the pelvis. Okay, so they're going to pull the front of the rib cage and the back of the pelvis closer together. And you can see as I twist to the same side, that band gets slack. You know, the distance is shorter between those 2 points. Okay. And this, by the way, is a fantastic way to cement this anatomy in your own brain and body. This is like 1/5 of a $5 flex band, okay, that I just cut up with a pair of scissors. One day it broke on someone's shoe or something. And you just figure out, all you need to know is like, where are the two ends of the muscle? Okay, well, if one end's here and the other end's there, well, muscles only ever do one thing, is they pull their two ends closer together. Okay, so if we just put this on your body, you can use it for leg muscles, arm muscles, whatever, right? If you know that the bicep starts here and ends there, okay, well, if I pull those 2 points closer together, you know, what does that look like? If you try and touch your elbow onto your shoulder, that's the action of biceps. Okay, so you can use this trick to really think about your anatomy and figure it out from just all you need to know is where's one end of the muscle, where's the other end of the muscle. You can look that up on Google, right? Just look at a picture of the muscle. You don't even need to know like the Latin names of where it is. It's just like, okay, it goes from here to here. That's all you need to know. Okay, and with the internal obliques, they go from here to here. All right. So to the degree that you're not 100% confident with that, go break yourself off like 30 centimeters of flex band, okay, after we get off the call. Go to Google, type in internal obliques, okay. Make yourself a homemade internal oblique, okay, and then make it shorter. Right, twist your body until it gets shorter. Figure out which way you have to twist to make it go slack. Okay, and that's the action of internal obliques. And conversely, if you wanted to stretch it, all you have to do is figure out how do you pull on it. Okay, and that would be the opposite.
Could you repeat the original question?
Left internal obliques rotates you which way? All right, I'm going to leave you to sit with that. But if you'd follow that process of get yourself an elasticated internal oblique, okay, this is good because it doubles as a bicep or a rectus femoris or anything else you want. And then Google internal obliques, okay? Just look at the picture on Google and put this on the same spot on your body, okay? And then figure out what way you have to bend or twist to bring the two ends closer together. And that's how you figure out the action of a muscle. All right, now...
I just had a thought there, Raph.
Yeah.
So with the two working at the same time, it's like the internal's assisting the external anyway on the opposite side, so it's just kind of making the movement better.
Bam. So your right external oblique pulls the right ribs forward and your left internal oblique pulls the left ribs backwards, right? And in layperson's terms, we call that torso twist or rotation. Rotation, right? So the external oblique rotates you to the opposite side. The internal oblique rotates you to the same side, okay? Which is what Zoe said right at the start. And so when you're twisting to the left, it's your right external, left internal working together, okay, and vice versa when you're going back the other way, okay, because the right external oblique pulls the right ribs forwards, okay, and the left internal oblique pulls the left ribs backwards, and that together is the same movement. Now, just to briefly finish up with the side bending of the internal obliques, they're going to have a very similar action in terms of side bending as the external obliques, right? Because they're going to pull the left internal oblique, say, is going to pull the left ribs closer to the left hip, right? So that's going to side bend you to the left. Okay. So if you're side bending to the left, it's the left internal, left external working together, right? Whereas if you're twisting to the left, it's the left internal, right external working together. It's kind of like one of those checkerboard games. And so if you want to really cement this in your brain, all you got to do is think about it a lot, okay? And think about it and preferably do it in your own body. So like I said with the flex band, okay, or just do an exercise and picture what's happening in, okay, this muscle's pulling from here to here. What's getting shorter as I do this movement? Picture it in your mind's eye. And if you're not sure if it's just a fuzzy grey picture in your mind's eye, well, get out Google and look at it, okay, and figure where it is, and then make the picture in your mind's eye. And the more you do that, pretty soon there'll come a time where you don't need Google because you can just picture it, okay? Maybe not in supreme detail, but it basically kind of goes from here down to your symphysis pubis, right, roughly kind of sort of, okay? And you can think, okay, well, if I pulled this point and my symphysis pubis closer together, what would that look like? And you'd be able to figure it out and go, oh, yeah, that's that, okay? And from that moment on, you never have to memorize the action of the obliques again because you can just figure it out, right? You don't have to remember it because you can just go, that goes that way. Okay, so at that point, I would say that you understand it because you're working it out, not regurgitating a memorized answer. And as soon as you get to that point, well, then you can start to think like, well, if I wanted to target that muscle, what action, what exercise would I do? It's like, well, that's what it does. So guess what exercise you'd do, right? You'd do that, okay? So that's when you can start to problem solve, maybe somebody's weak in this movement or maybe someone has a pain in that particular movement or whatever. You can start to figure out, well, how can we challenge that muscle in a different way or less or more sort of thing. But the first and biggest step, not biggest, the first and most important step is just being able to make that picture inside your mind's eye and being able to manipulate that picture so that you can figure out what would happen if we pulled those two ends together. What would that look like on the body? Good job, team. We're just about out of time. And I'd like to thank you for your contributions, particularly those of you who asked questions, particularly those of you who asked questions that you might have thought were dumb questions. They weren't. And also thank you to those who contributed answers, especially when you weren't 100% sure yourself. So that's awesome. that this is the way you learn, right? You think about it, you explore, and when you start thinking about it, you realize, oh no, I didn't quite understand as much as I thought I did, and then that's when you get the opportunity to move to the next level. All right. Well, I hope you found this helpful. If you're watching afterwards on Facebook and you've got a question, just type it into the comments, and I'll get back to you. See you next week.